Hi, I'm Dan Bunker. I'm a specialist plastic surgeon from Launceston, Tasmania, and I trained in Sydney, Melbourne and Europe, and today we're going to talk briefly about abdominoplasty. So an abdominoplasty is a pretty common surgical procedure, and in essence it actually has kind of functional and cosmetic components to it. The extent of an abdominoplasty can vary significantly depending on the habitus of the patient's body, how much skin or fat needs to be removed, and whether we need to repair any of the muscles within the anterior abdominal wall. An abdominoplasty surgery really requires a thorough clinical assessment to ascertain if you're ready for the surgery in terms of your tissues and the amount of fat you have on your abdomen. And we also assess the muscle separation if that is evident in every patient. Muscle separation commonly occurs as a consequence of pregnancy, and some patients after that have issues with weak core strength from having separation of the six-packs or rectus muscles at the front of the abdomen, and we can actually repair that and bring those muscles together during surgery itself. In terms of abdominoplasty surgery, it's important that you're optimised for the procedure because there's often large incisions after abdominoplasty that need to heal. So you need to be at a reasonable and stable weight for the procedure. You need to make sure that you're not smoking. There's other things we look at, such as the use of blood thinners and other medications which maybe need to stop pre-operatively. The procedure itself involves resection of skin and fat from the anterior abdominal wall, and as I mentioned before, sometimes repair of the muscle layer. Depending on how much skin and fat we need to remove, sometimes the scar is low on the abdomen and short, sometimes it's from hip to hip, and sometimes there's also a vertical component on the anterior abdominal wall as well. And your surgeon will talk about the operative planning before you undergo surgery. In terms of recovery, it's important you understand that there is a recovery process after abdominoplasty, especially if you have muscle repair. You may need to wear an external brace, which we call a binder, for up to 6 weeks to help support the tissues as they heal. And in some cases, you will also have drains that need to be removed, which help remove fluid after surgery to prevent fluid accumulation under the skin. You should prepare to have probably 6 to 8 weeks before you're back to doing heavy or regular exercise or core work after most abdominoplasty surgery, and that's something that you need to take into your planning when you're seeing your surgeon for abdominoplasty. So make sure you have a detailed discussion about what to expect and your recovery, and ensure you have appropriate support for yourself at home.